Hello, my name is Brooke Lopuk. I am a care manager in the Utilization Management Department at Partners BHM, and this video will go over how to submit a service authorization request or a SAR using Alpha. So we'll start on the left where it says SAR, and that will open up the SAR module. And you have a couple options here, starting with My SAR, All SARs, Filter, that's how you search for a SAR, or Create. So since we're starting from scratch, we're going to hit Create. And the first thing it's going to ask you for is the patient. So you'll notice these asterisks. The red asterisks are required fields, and the green asterisk means that you need to have that filled out in order to submit the SAR. So first we're going to add a client or a patient. So you want to add 3 pieces of information to find the client. That's the quickest way to find them. So I'm going to add the name and the date of birth. And then you click search. And there's our client. We can highlight that and select patient. And that will add their information there. Provider details, the number's already added for you. The legal guardian name, if they don't have a guardian, you can just write self. Relation, none. The initial date of assessment, that's auto-populated to the date that you're putting in the SAR. So today is February 15th. You can change that if you like. The next box is the expedited box. So this changes the response that you'll get from utilization management. So if you check this box and your case will be reviewed within 72 hours for most services, it will be reviewed within 24 hours if you are if it is an inpatient case or a hospitalization. But this is only in times when there is a health and safety issue as to the reason why it needs to be reviewed sooner than the typical time frames. So if you check this box, you're going to need to put some extra information in your justification as to why it is in fact expedited, what the health and safety issues are. The retrospective box, that's if the start date is prior to the day you submit the SAR. And that's only in certain circumstances. For example, if the client has retroactive Medicaid, or if you've been given special permission from the UM director or UM manager to submit a retroactive SAR. Moving down, you can pick voluntary or involuntary. And this is their primary issue: mental health, substance abuse, or developmental disability. You can only pick one of these. We understand the clients are sometimes dual diagnosed, but just pick what is primary, and it corresponds with the service that you're requesting. And then is it an initial or a reauthorization? So an initial would be someone new to treatment or is returning to treatment and there's been a lapse in authorization. And then a reauth is, of course, after they've already been authorized, they're just continuing the service. So if they have a mental health diagnosis, you need to pick a locus level of care, and it's in the drop-down menu here. And if they have a substance abuse diagnosis, you're going to need an ASAM level of care as well. And that's even if they are in remission. The CAL locus is only for children up to age 18. So this patient is an adult, so that's why the locus is available. And then the SNAP is for developmental disabilities. Moving down to the diagnosis. So in this field, we need the ICD-10 code for the diagnosis, or the F code. So if you start typing the diagnosis in, it's going to give you some choices in a drop-down box, but it's going to be the wrong code, the ICD-9 code or the 300 code. But if you start typing F and give it a second to catch up, let's say, then you can find, if you start typing the ICD-10 code, then you can actually get the diagnosis that pops up in the drop-down box. The psychosocial score you can put there, the level of care recommendation. These are not required fields, but you're welcome to fill them out. This is where you would add any substance use. So if you want to add, you click the plus sign and then you hit add. So then you'll add all of these details about it. Primary, priority, the substance, the route, the frequency, the amount, the age of first use, and then the treatment start day, and click save. And then if you want to add another one, another substance, you click add. Or if you click on the row, you can either delete or update what you've already put in. Okay. Moving down to medical use, you can add their primary care physician there, and if they've signed a release. Are they medically compliant or medically non-compliant? And any comments you have there. Next, you have your medications. So again, click the plus sign and add a medication. And as you start typing, it should give you a drop-down box. You can add the dosage, the number of refills, and the medication regimen. So how often they take it. Click save. And again, you can highlight it and it will give you an option to delete or update. And if you want to add more medications, you click add. Any allergies you can type in there. Next we get to clinical documents, so we want to click add. And then the documents you want to add to your authorization can be found on the benefit grid. So you find the service that you're requesting, and then over to the right is where you'll find what documents are needed. So often we like to have the assessment, the person-centered plan or treatment plan with the signature page and crisis plan. And the PCP, crisis plan, and signature page should all be one document. It was created that way. Now I understand that there is some size limits on the size of the document that can be uploaded. So if you need to split it into two to get it to upload, that's fine. Or you can fax the documents if you can't seem to get it uploaded here. You can fax the documents to 704-884-2701. But if you want to upload it here, you click the document type, the effective date. You can add an end date if you want, and then you click upload file, and then you find your document and double click it, and it will add there. Next is the request for the service. So you will start with your benefit plan, your definition, your service code. These are all drop-down menus, and then the site address. The effective date should be the same day as today, unless it is a retroactive SAR. And then your end date. So ACT is typically 6 months. So 1, 2, 3, 4, 5, 6. So one thing that you want to keep in mind when you're putting in end dates is the expiration date of your treatment plan or your person-centered plan, because we cannot authorize past that date. And also you want to think about when their last, or you want to find out when their last authorization ended. So we can't have overlapping authorizations, so their last authorization would need to have ended on 2/14 to start this new authorization on 2/15. Next, you want to put in your units. So this is billed in units per month. And then if you click, after you click monthly and you click over, just in this gray area, it will actually calculate the units for you. But if for some reason the total units is not coming out correct, then we can recommend that you click per auth, so then you know that the number is correct and it's going to calculate correctly. This is the EPSDT box, and that is only for children up to age 21 who have Medicaid. So only check this box in those cases. Otherwise, just leave it blank. And then here is where you put your justification for your authorization request. And in here, we like to see documentation of any progress towards any identified goals, any new concerns, and any information as to why there is a change in service. So if they're moving up or down a level of care, we want to know what the reason is for that. And then also what's really important here is to put in your name and your contact number. Oops. Make sure it's the right number. So this is really important because the care manager may have questions about this case, and if your phone number, the correct phone number, is here, that's the quickest way that we can get in contact with you. We can get what information we need quickly, and we can either approve or move forward on your case much faster if we can get a hold of you. So please add that contact information. So say if you are putting in this SAR and the site is not listed in the drop-down menu. So you would need to go back again and make sure you click the right definition, the right service code. It has to be done in this order. And also you can contact your provider network specialist. There may be an issue with your contract that the site is not listed under that service code. So if the options are not correct, you need to contact your provider network specialist about that. Moving on, if you want to add a service, you click this button and it gives you a box just like this. So if you were going to do a bundled SAR, if you were doing outpatient and you wanted to do several service codes like 90853, 90837, you can click Add Service. Okay, so at the end of this, and I'm not quite ready to submit it yet, so I'm just going to save it. And here it is on my SAR. So it's got your ID number, your agency, your patient, days remaining 0 because it hasn't been submitted yet, and status is saved. So I'm going to highlight that, and here's where you get your options. So you can copy the SAR, you can view the SAR, you can update the SAR, or get details. So what I'm going to do is update it because now I'm ready to submit it. And I'm going to go down to the bottom and hit submit. There we go. And it's been submitted. So now I'm going to filter for the SAR and There it is. And it says it's under review, and it's got 14 days. So if you wanted to take a look at it after you've submitted it, you can hit view, and you can view the SAR to make sure everything is correct. You can't make any changes in this, you can just view it. Okay. There is a rescind button, so if you realize after you've submitted it that you put in something incorrect, you can rescind it, which means you take it back from UM, and you can make the changes and submit again. You can open up the details, and this will give you previous auths. You can go to diagnosis, provider communication, we'll go in there. And these are where the notes, any care manager, if they need more information, they will have a note in here saying what documents they need. So if you want to upload those documents, you can hit create, and that will create a note. Put in the comment type. Just say need more information. Okay, you can put a comment in here. Here's the info you requested. And then you can upload the document right there. You hit save. And there's your comment. And clinical, you can go to, if you want to know who the SAR is assigned to. It was transferred to Brooke Lopuk. Previous auths, there aren't any listed here because this is a test client, but in here would be the authorizations that they've had, so that would tell you when their last authorization date was. Their NC tracks, their substance use, and here's documents. I haven't added any, so there aren't anything there. So that pretty much goes over it. And then if you wanted to say the next authorization, you don't want to start from scratch with a brand new SAR, you can filter for this SAR and then hit copy SAR, and it will fill out everything exactly the same without the documents uploaded. But the patient is in there, the diagnoses, etc. So you'll need to remember to change the start dates and the end dates, and add a new justification and add your documents. So that's a quick way to copy the SAR for the next authorization. And view the SAR cycle just kind of gives you a timeline, when it was created, when it was assigned, when it was reviewed, etc. So of course you can always, if you're having technical issues, you can contact the help desk at 704-842-6431. And then also we have work group numbers, and that is if you need to talk with someone in the utilization management department. So for the MHSU work group, this is the phone number, 704-842-6436. For the IDD department, their work group number is 704-884-2605. And then the inpatient team has their own work group number too, and that's 704-842-6434. So feel free to call us if you have questions or if you're having trouble submitting a SAR for some reason. And I hope this was helpful, and feel free to contact us if you have any questions.